Okay, so what if I told you that there's a hidden door in your heart? A feature left over from before you were even born that can, in some cases, act like a secret passage through your circulatory system. It's this super fascinating and surprisingly common condition. So let's dive in and, unlock the mystery behind this hidden door. Okay, get this. 1 in 4 adults, that's 25% of the population, is just walking around with a small hole in their heart. And no, this isn't some super rare defect. It's actually a pretty common variation from birth. I mean, statistically, you definitely know someone who has one, maybe even a few people.
So what are we talking about here? Well, it's called a patent foramen ovale, or PFO for short. And before we're born, this little opening is actually essential. It's supposed to be there. It lets blood bypass the lungs, right? Because they aren't being used yet. But then, after we take our first breath, this little flap is supposed to swing shut and seal it off for good. But for about a quarter of us, it just doesn't. It doesn't seal up completely, leaving this tiny tunnel-like passage.
Now look, for the vast majority of people, this unsealed door is no big deal. It's completely harmless, causes zero issues. But sometimes, under just the right or maybe wrong conditions, that little door can swing open, and that's when it can start to create a problem. Let's take a look at how that happens.
Okay, so think of your lungs as the body's ultimate filter. It's like this incredible built-in purification system. All the blood coming back to your heart is supposed to pass through the lungs first before it gets sent out to the rest of your body. And in the lungs, it gets filtered. Tiny blood clots, other little bits of debris, they all get screened out. But a PFO, it creates what doctors call a right-to-left shunt. It's basically a shortcut, a detour that lets some blood completely bypass this super important filtering step.
So what happens when something slips past that filter? Well, tiny clots or other bits of gunk can get a direct, unfiltered express ticket to some of the body's most sensitive command centers. We're talking about the brain, the spinal cord, and yeah, even the retina of your eye. And that right there brings us to the most significant, the most well-studied connection of all, the link between a PFO and what's called a cryptogenic stroke. That's just a fancy term for an unexplained stroke, and we see this link especially in younger people. And you know what? The evidence here is just powerful. There was this landmark study called the clot trial. It focused on patients who'd had one of these unexplained strokes and also had a high-risk PFO. And when they went in and closed that hole, the result was just staggering. Over 5 years, there were 0 recurrent strokes. Not one. Absolutely none. It's wild. I mean, just to put that in perspective for you, patients who are treated with just medication, they had almost a 5% chance of having another stroke. Now, compare that to the 0% risk for the folks who had the PFO closed. The difference is just, it's night and day. Absolutely stark. And look, this isn't just a one-off result from a single study. When you pull all the data from all the major trials, the conclusion is crystal clear. For the right patient, closing that PFO reduces the risk of another stroke by about 60%. That is a massive, truly life-changing benefit. But, and this is a really, really important point, this procedure isn't for everyone with a PFO. The guidelines are super specific. We're talking about younger patients, generally under 60, who've had a stroke with no other clear cause and whose PFO has certain high-risk features. It's all about pinpointing that exact person where the PFO is almost certainly the culprit. Okay, so the link to stroke, it's pretty clear-cut, but what about other conditions? Well, this is where the story gets a bit more mysterious, and honestly, the science becomes a lot more controversial. So, the biggest debate by far is all about migraines. It kind of started with these anecdotal reports, stories of people, a lot of them scuba divers, who got their PFOs closed for other reasons, and then suddenly their migraines were just gone. But when scientists actually put this to the test in big, proper clinical trials, the results were pretty mixed. Yeah, there's some data suggesting a small benefit, especially for people with migraine with aura, but it just wasn't a slam dunk. So as it stands today, the major medical guidelines say, nope, you don't close a PFO just to treat migraines. There are a couple of other interesting potential connections, though. First up is decompression illness in scuba divers. You can imagine how dangerous it would be for nitrogen bubbles to bypass the lungs' filtering system. That can cause serious harm. Then there's this really rare condition called transient global amnesia, or TGA. It's this sudden but thankfully temporary episode of memory loss that some researchers think might be caused by those tiny emboli crossing a PFO and briefly affecting the brain.
Okay, so with all this talk about shunts and hidden doors, you're probably wondering, how do doctors actually find it? Well, the answer is a really clever and pretty cool test called a bubble study.
It's actually a pretty straightforward process. First, the doctors mix up this harmless solution of saline with some teeny tiny microbubbles in it. They inject that into a vein. Then, while they're watching your heart with an ultrasound, they'll ask you to do a little strain, kind of like you're bearing down. What that does is it momentarily raises the pressure on the right side of your heart, and they want to see if that pressure can push that hidden door open.
And then you get the big reveal. If a PFO is there, that pressure change will push the flap open, and the doctors will literally see a cascade of bubbles crossing from the right side of the heart over to the left. It's like, boom, there it is, a definitive visual confirmation that the shunt exists.
So, after going through all of this, we land on the big question, right? To close or not to close? Let's bring it all together and figure out the takeaway.
All right, so here's the bottom line. This hidden door in the heart, it's incredibly common. 1 in 4 of us has one, but it only really becomes a problem for a very select group of people. For those younger patients under 60 with an unexplained stroke, PFO closure is a total game changer, hugely effective. For just about everything else, especially migraines, the science just isn't there yet to recommend it. It really shows that the decision to close one isn't simple at all. It's a highly individualized choice you have to make with your doctors.
And that kind of leaves us with a really fascinating thought to chew on. A PFO is the perfect example of a common anatomical trait that, for most people, is nothing. But under a very specific set of circumstances, it becomes a real medical problem. It really makes you wonder, doesn't it? When does a simple variation in our anatomy, something that's just part of who we are, cross the line and become a condition that needs to be fixed?